Have you ever wondered if your runny nose is from allergies, that persistent tickle in your throat, or that feeling of being utterly drained? It can be tricky to pinpoint the exact cause when you're feeling under the weather. A cold, that common nuisance that seems to circulate endlessly, or maybe even the flu, that more formidable foe that can knock you off your feet. You're not alone. Millions of people grapple with these questions every year, trying to decipher the signals their bodies are sending. These three allergies, colds, and the flu can feel pretty similar at first glance, often presenting with overlapping symptoms. But there are key differences, subtle yet significant distinctions, that can help you figure out what's going on and guide you toward the right course of action. Let's break it down, nice and simple, so you can become a bit of a symptom sleuth yourself. First up, allergies. Allergies happen when your immune system, that normally helpful defender, mistakenly identifies something harmless as a threat, like pollen from trees and grasses, or those pesky dust mites lurking in your home. The most common symptoms? Let's run through them. Sneezing fits, itchy or watery eyes that just won't stop, runny nose that seems to have no end, and sometimes a scratchy throat that makes it uncomfortable to swallow. Allergies usually don't cause a fever, which is a key differentiator, and you'll notice symptoms last as long as you're exposed to your trigger, sometimes for weeks or even months, depending on the allergen and your level of sensitivity. Now, let's talk about the common cold, that familiar visitor that seems to pop up at the most inconvenient times. Colds are caused by viruses, those tiny but mighty invaders that wreak havoc on our respiratory systems, and they typically sneak up on you slowly, giving you a little warning before they fully take hold. You might start with a sore throat, that scratchy, uncomfortable feeling that makes you want to reach for a lozenge. Then a runny or stuffy nose, making it hard to breathe and smell, and sometimes a mild cough that tickles your chest. Mild body aches can happen, leaving you feeling a bit sluggish, but high fevers are rare in adults with a common cold. Most colds clear up in about a week, allowing you to get back to your normal routine. Next up, the flu, short for influenza, a more serious respiratory illness that can really put you out of commission. The flu is also caused by a virus, but a different strain than those that cause the common cold. But here's the big difference. The flu hits fast and hard, unlike the gradual onset of a cold. One day you're feeling perfectly fine, energetic, and ready to tackle the day. The next, bam! You've got a high fever, chills that make you shiver uncontrollably, intense body aches that make every movement painful, headaches that pound in your head, and serious fatigue that leaves you feeling utterly drained and unable to function. The flu can also cause a cough and sore throat, adding to your misery, but it's usually more severe and debilitating than a cold. The worst of the flu usually lasts about a week, keeping you confined to your bed. But that tired feeling, that lingering exhaustion, can hang around for much longer, making it difficult to get back to your normal energy levels. So, how can you tell the difference between these three common ailments? If you have itchy eyes, sneezing, and no fever, and these symptoms tend to occur during specific seasons, think allergies. If it starts slow with a sore throat and you feel a little under the weather, with mild symptoms that gradually worsen, it's probably a cold. But if you suddenly feel wiped out, have a high fever, and your whole body aches intensely, leaving you feeling like you've been hit by a truck, it's likely the flu. It's important to remember that allergies aren't contagious, so you can't spread them to others, but colds and flu definitely are. So wash your hands frequently and thoroughly, and cover your cough to prevent the spread of germs. And if you have trouble breathing, experience persistent chest pain, or develop a high fever that won't go away despite medication, it's always best to see a doctor to get a proper diagnosis and treatment plan. Knowing the difference between allergies, colds, and the flu can empower you to take better care of yourself, make informed decisions about your health, and protect the people around you. Stay healthy, stay informed, and thanks for watching.